Dr. Theodore Chu, and I'm an allergist in San Jose, and I've been doing allergy for over 30 years. I won't tell you how long. And I'm here to talk to you about what you ought to know about allergies. Now, allergies are a supersensitivity to certain irritant factors or allergens. And there is a hygiene hypothesis which says that your immune system wants to attack germs. And here is a picture of pneumococci. Whoop. Pneumococci here, which are these little black specks here. They're germs, okay? They can cause pneumonia. And if there are not enough germs around, your immune system is looking to attack other things that can attack dust mites here, or pollen grains, such as these ragweed pollens seen on the scanning electron microscope here. They can attack foods and other allergens, things that are normally not harmful, but the body thinks they're harmful. Like, you're not really going to have any problem. A food is not going to invade your body and kill you unless you have an allergy to it. It's not like a bacteria. And pollen grains don't normally come into your body and invade you, and dust mites don't come in your body and invade you. So if you're reacting to that, it's an overreaction to something that's normally harmless. We call that an allergy. Here are some of the kids who have different kinds of allergy. This kid has allergic shiners under his eyes. This kid is giving the allergic salute, where he's pushing up on his nose so he can get air through his nose. This kid is breathing through his mouth. This one has eczema on his face. Here's her eczema on his neck, or that may be hives. And this one has swelling of the eyes from allergy. So those are some of the things that they can have. This is the cost of allergy in the world. It's estimated that 23 million people in the US have allergies, costing $3.4 billion for nasal allergies and $6.2 billion a year for asthma. So now here was one of the first articles by Erika von Mutius in Germany comparing the number of people who had allergies in East Germany and West Germany. Now, as you know, the Germans are all a bunch of blonde-haired, blue-eyed krauts, okay, the whole bunch of them. And they were genetically fairly similar, and this was done on white people in Germany. It wasn't done on immigrants, okay? Except they had a Berlin Wall for 40 years separating them. And in the communist regime, all the kids were sent to daycare so the mothers could work. And when the kids were sick, they didn't send them home. They kept them in daycare. Also, there was lots of bronchitis and infections in East Germany because they had lots of pollution, because they burned coal, because they couldn't get oil. So when the wall came down in the late 80s, they thought that for sure that there would be much more asthma in East Germany, but in fact it was only about half as much. And the skin test sensitivity was half, and hay fever was half. There was more bronchitis in East Germany, and there was more sensitivity in West Germany to things like mites and cats and pollen. And we know that it was cleaner in West Germany because if kids were sick in daycare, the daycare people would call up the mom and tell them, you take your kid home, you're going to get the other kids infected. So it was the opposite. Okay? So when you have cleanliness, you have an immune system which is bored. Okay? It doesn't know what to do. So it's looking for something else to attack. And we call that an allergy. Okay? There are other things for you from Asia. You would like to know that if you go to, this was a study done by a guy named Leung, and he did a questionnaire in Cantonese. Okay, so there's no bias about that, asking them if they had ever had wheezing or asthma. And he did it in Canton in Sanbu. He did it in Kota Kinabalu, which is part of Borneo, which has a Cantonese population there. Sanbu at that time was quite primitive, not much health, it wasn't necessarily clean as the cleanest place in town, in the world. But then here in Kota Kinabalu is sort of intermediate, and Hong Kong was quite clean, okay, because it's all city living. So as you notice, you go from dirty to moderate to clean, there's a higher incidence of asthma. And this was in 1995 that this article was written, or I read it in 95, and it came with a accompanying editorial by Fernando Martinez, who's an epidemiologist in Arizona. He said, can it be that early childhood infections are actually protective of asthma? And now we think that it is. So that if you get infections early in childhood, then your body is going to be tuned against infection, and it won't go to try to look for pollen grains, and you won't have asthma, you won't have hay fever, you won't have as many hives, stuff like that. And there was a study done in Guinea-Bissau, Africa, which is a little place in Africa, and they asked people, have you ever had the measles? Okay? Now, people who don't get measles, that means they must have probably had the measles vaccine, and they were probably quite smart about germs, okay? So when you had the measles, it meant that you didn't get the measles vaccine. Well, if you got the measles, if you had a measles infection, you had half the allergy. Atopy means allergy, compared to those people who did not get the measles infection because they got the vaccine. So vaccines are protective, but also they make you more prone to getting allergies. Now, if you breastfeed for a long time, you know that that's protective for allergies. Everybody knows that. So those who do not breastfeed as much, there's more allergy. And for those people who had less schooling, if you have less than 4 years schooling, you don't even know what germs are, okay? And so you probably aren't as clean. And the most humorous part of this is they asked as part of the question of the questionnaire, do you keep pigs in your house, okay? People that are primitive keep pigs in the house because pigs are a valuable commodity for food, okay? They don't want somebody to steal the pigs, so they stay in the house with them, okay? But any civilized people, you're not going to sleep with pigs in your house because pigs are dirty, okay? So people with pigs in the house has probably got a dirt floor and it's got a grass shack, type house, okay? But when you sleep with pigs in the house, you have less allergy. The correlation was not great than when you sleep without pigs in the house. So one of my neighbors said, well, that means that my wife is saying that I'm a pig around the house all the time and it's okay. And the answer is no, it's not okay, because you have to have your infections early in life, okay, for it to be protective. So there was a study by a guy named Bach in the New England Journal who said that over the last 50 years there's been a decreasing incidence of a lot of common diseases such as hepatitis, tuberculosis, mumps, and measles. And in the meantime, asthma has increased, as well as type 1 diabetes here, multiple sclerosis, and Crohn's disease. You can hardly see the type 1 diabetes. It's in the red here. You can hardly see it. It's like, but all these immune disorders are going up over 50 years as common infectious diseases go down. So this is the old Chinese yin-yang hypothesis that basically you don't get something for nothing, okay? The more clean you are, the more allergies you get. The ancient philosophers always knew that there is no such thing as only good, okay? There's always evil as well as good. and the two have to counterbalance each other, and you hope the good wins, but you really can't get away completely. So I find this very interesting, that it's a philosophical as well as a medical type graph when you look at it carefully. Okay? So what are the prevalence of the different disorders? Well, food allergy is more in the young kids, and eczema, which is a rash, is more in the young kids. And then when they get older, they have more asthma and nasal allergies. Allergic rhinitis is nasal allergies. That comes later, okay? So about age 6, you're going to know whether your kid is going to have trouble with allergies or asthma. See that? And before that, you know, they can have food allergy and eczema, which are sort of giving you a hint that maybe they're going to have some trouble with other diseases later. Here's a picture of allergic rhinitis, nasal allergies. This kid is breathing through his mouth. He's got dark circles under his eyes. He has, if you look inside of his turbinates, the inside structure of his nose, he's got a lot of clear mucus there, and it's pale and congested because of allergies. His body is fighting pollen grains, which are really actually harmless, okay? In asthma, what happens is you have bronchial tubes that go into constriction. This is the airway, and the airway, the trachea branches into bronchial tubes for the right and left lung, and that goes further into smaller and smaller branches, and it ends up in little air sacs, which we call alveoli. And in asthma, the bronchial tubes go into constriction, as you can see here. So you can't get air into the air sacs, and you have less oxygen, okay, and you feel short of breath. Now, there are a lot of different things that can precipitate asthma besides pollen grains. Cats and dogs can do it. Certain medications can do it. Weather changes can do it. Infections, that's one of the major things that can do it. Some patients have exercise-induced asthma. Even a change in barometric pressure can cause problems, okay? And not everything is an allergy. Some things are just strictly irritant. For instance, yes, yes, sure.
Can we have the light in?
We can see it better. Jennifer, can we shut down the lights a little bit in the front anyway? I don't know how we can do that real. You can cut them all back just a little bit. People won't fall asleep. This will be not too long. Can you cut them down a little more, Jennifer? I think near the front, maybe we can somewhere. I'm not sure. This one? No, that didn't do anything. I think it's up there behind the stage somewhere, but we'll go on. And okay. So just a few words about asthma. As I said, about 22 million people in the country have it, and it's due to overreaction to pollens and pets, pet dander, mites, sometimes aspirin can do it. Infections is a major cause. And it's due to obstruction of the bronchial tubes and makes you short of breath. You get a feeling of chest tightness or wheezing, coughing, often worse at night or when walking or exercising. And in 75% of children and 50% of adults, there are allergy triggers. In the others, they're called intrinsic asthma, meaning that something inside your body is causing it. And a number of allergists years ago thought that it was due to infection, but it probably isn't. It's probably a lot more complicated than that. And you have to see your allergist for asthma evaluation, for skin testing, allergy evaluation and treatment. And treatment is with avoidance, first of all, if you have, that's the first principle of treating allergies. Avoid, if you have pets and they're causing a problem. I have a patient who recently admitted that she thinks her dog was causing the problem, and she's going to have somebody take her dog, so you won't have the dog around, because she has terrible asthma right now. And then use bronchodilators, and then inhaled steroids and combination meds. I'll have a slide of that at the end, and something called long-acting beta agonists, which are a bronchodilator that lasts for a long time. You have to treat infections and perhaps allergy shots or other shots like epinephrine or something. Intravenous medication sometimes, but rarely. And for severe cases, allergy shots or a new medication called Xolair, which is very expensive. It's about $15,000 to $30,000 for the cost of the medication alone per year. And we have about 6 patients in our practice that are on it, maybe about closer to a dozen now. They're really severe allergies. Asthma. Eczema. Okay, I'll show you a picture of a kid with really bad eczema. This is infected eczema, and then after you treat them with antibiotics and medication for a while, it looks a whole lot better. So that's what you can do if you have this scaling condition of the skin. You can treat it and make it better. And here's a more typical example, which is just, I'm sorry that didn't show up much, but there's a rash, usually in the folds of the arm and behind the knees. And eczema, also called atopic dermatitis, is dry, itchy skin that often becomes infected, and it's more common in children than adults, 10 or 15% of kids. And it says here, misspelled, 90% start having it before the age of 5. The cause is not known, but we know a lot more about it than we used to. Oftentimes, it's a precursor for allergies and asthma, and there's a strong family history. Hay fever and asthma often occurs by the time they're teenagers. And it's also called the rash that itches, because oftentimes it'll itch first, and after it itches, then if you scratch it, the rash will come out. So it's important to avoid wool and other scratchy type fabrics. You can use antihistamines for the itching. It occurs on the cheeks in infants, but then as one gets older, it occurs here and behind the knees. It occurs in the folds. And you can use moisturizers to help the skin from being dry so you won't scratch it. Then you can use steroid creams. There are a group of compounds, including Elidil and Protopic, that were once quite popular, but now the head of dermatology at Stanford told a dermatologist who told me that he thinks there's some evidence that might cause cancer, so he doesn't use it anymore. So you don't want to get rid of your allergies and develop cancer instead. That's not a good trade-off. So that drug is not as popular. Now, oftentimes patients ask me if foods can be a trigger for eczema. And I'd say that in about 40% of kids, possibly. Those are the ones that have positive skin tests, less frequently in adults. And here are some of the most common allergenic foods: eggs, peanuts, milk, fish, soy, wheat. If I had to pick one food that causes the most positive skin tests and probably causes trouble in kids, is egg white. Okay. It was worse years ago because one of the favorite things for parents to do years ago was they would take a cow's milk and they would put raw egg with egg white into it for added nourishment for the child. But the raw egg white is very highly allergenic. So I don't do that anymore. Okay. Now there's a condition called hives, which is swelling of the skin like this. It's also called urticaria, which is the Latin word for urtica is a stinging nettle. It's a bush that has prickles on it that stings when when you touch it, so it's called urticaria because it stings and itches. These are bumps on the skin which can cause swelling of also the lips and airway, which is rare. That's called angioedema. Lesions come and go, causes not known. Oftentimes you can test for foods or drugs, but rarely do you find a cause for it. Every now and then we find a cause of food or something. Viral infections can cause it. About once every year or two, we find a patient has thyroid disease, which is causing hives. And there are certain physical urticarias, such as pressure urticaria, delayed pressure urticaria, cold urticaria, which happens quite frequently. Kids their hands get swollen because their hands are colder than the rest of their body, and they get swelling on their hands. Acute hives is less than 6 weeks, and chronic hives is when it goes more than 6 weeks. And they just had an article in the New England Journal of Medicine for chronic unremitting urticaria this week that they treated with Xolair, that same medicine that we use for asthma, and apparently worked. But I don't think insurance companies are going to allow people to spend between $15,000 and $30,000 a year to get shots of Xolair so that they can make their bumps go away. Instead, they're going to want them to take antihistamines like Claritin or Allegra Zyrtec, which Claritin now costs 3.5 cents a tablet. That's more. And then they would use an EpiPen for severe swelling. Okay, now here we're getting to a few rare things. This is a stinging insect. The stinging insects that can cause problems are honeybees, wasps, yellow jackets, and hornets. Okay, here's a question. Which causes more deaths every year in the United States? Lightning or stinging insects? That's what everybody says. This is an allergy lecture, right? But the answer is stinging insects cause 40 to 100 deaths per year, and lightning causes 300. Because if you're hit by lightning, it's usually over. Okay? Although I had an employee once that said that she had a friend in Kansas that had been hit by lightning twice and survived both of them. But he wasn't very smart by the second time because he went out in a thunderstorm to see what was going on. So that's why, at least if you get stung by an insect, you have a chance, okay, if you're allergic to it. And
how many insects get killed by lightning?
Say again?
How many insects get killed by lightning? No, I'm kidding.
How many insects are killed by lightning? Probably millions. Okay. Now, there are over 16,000 species of these winged insects called Hymenoptera, but there's only 4 that actually cause much stinging, and I'll go back a slide. And so the honeybees are, let me go back to this one. Honeybees they're kind of brownish with yellow stripes on them also, and they're very docile animals. They usually are found in man-made hives, which are the boxes, the white boxes around places. Sometimes you see them old barrels or the trunk of a tree, which is a natural place they occur. And honeybees are not going to come attack you. Okay? They're interested in flowers and stuff like that. But they will cause a problem if you step on them or if you are wearing dark clothing. They're attracted to dark clothing, and then they get caught in the folds of the clothing, and you don't know what's there. You think it's a fly or something. You go like that. That startles them, and then they're gonna sting you. Okay. So when you're around bees, walk slowly and try to move away. Okay. But they won't come after you. Now, yellow jackets kind of look like bees, but they have more distinctive black and yellow stripes, and they're a little smaller, and they have this side-to-side action before they land like this, and they're interested in meats, whereas the honeybees are interested in sugar. Wasps have the typical wasp waist, the real tiny waist, and they're found under eaves, either paper wasps or mud wasps under eaves. And hornets, they don't have very many hornets in this area. Mostly they're either wasps, yellow jackets, or honeybees. Okay? So if you do have a reaction to these things, if you have just a large local reaction at the site of the sting, you don't have to worry about that too much. But if you have hives, swelling of the throat, swelling of other areas, nausea, vomiting, low blood pressure, fainting, perhaps collapse, wheezing, then you need to go to an allergist. And an allergist will give you an EpiPen. I just took this picture of an EpiPen, and I brought one with me. Oh. So it looks like this. And this can be life-saving if you happen to have a severe insect allergy. And this has to be prescribed by a doctor. And the way you take it is you take the cap off of here, and you can, if you can take your pants down, then take them down. But otherwise, you can just poke it right through the clothing, like that. Can you see? Just like that. And then leave it there for a second or two so the needle can go in, and you pull it up. And when you pull it up, this guard will come down. This is just a demo, okay? And it'll cover the needle, okay? But you prime it by taking this off. So this is what you do in case you have a really severe sting. And then you can take allergy shots for the venom, and that will, in fact, that'll make you better. That'll make you less sensitive to the sting, and you won't go into anaphylaxis. Okay, so here are some of the usual allergy triggers: pollens, dust mites, mold, smoke, pet dander, food, strong odors, chemical fumes. Some of these things are not allergenic, they're just irritative. Here's a house dust mite, okay? Everybody has a million of these in their home, okay? And so particles from the house dust mite can get into your nose and your lungs, and it can make you sneeze, and it can make you wheeze, okay? And for years, other doctors said, what are you allergists doing? They said, why do you have, you guys collect house dust in shoe boxes and from vacuum cleaners, and you extract and you give patients shots of that and they get better. What are you doing? Well, it turns out that this is the creature that was in that house dust. And now they have purified cultures of the dust mites that they crush up and they use in extracts. Here's my cat, which can cause allergies, okay? He's an outside cat. And as you can see, the cat hair is very fine. The dander on the cat hair is very fine. Dog hair is not so fine. And that's one of the reasons that cats seem to be worse allergy-wise than dogs, but they can both cause allergies, all right? Here are some of the pollen counts that I did, and I think the green ones, which you can see here, are the trees, various trees, and the blue ones also are trees. And then here in the yellow is the grasses. So anytime from January, February, that's now, all the way through June, there's lots of pollen in the air. And I'm the only allergist in town who's dumb enough to do pollen counts himself once a week. Okay, now you can see that weed counts in this area are low, although in the back east you'll have ragweed. It gives you very high counts in the fall, but not here in California. Okay, so this is Acacia, which is something that comes out in February. And everybody thinks when you see a brilliant colored tree that that's really a major cause of allergy, but actually it's not, because when it has big flowers and is brilliantly colored, it's more, this kind of thing is more insect pollinated. So the pollens are heavier and they go right to the ground. So unless you have one right near your house, it's not going to cause much trouble, okay? So only 10% of plants have wind-borne pollen distribution, which is called anemophilous, okay? they have small, unattractive pollen. This is a cedar tree, which is pollinated, I'll show you. Whereas the bright pollens, the bright flowers have big pollen grains. It sticks to insects like honeybees and is transferred by honeybees or birds from one flower to another. There's some like Acacia that has some wind-borne pollen and some insect-borne pollen. Now here's Bermuda grass. You can see the little five-sided stars here. You can probably barely make these out here. Inconspicuous flower, but it puts out a lot of pollens. Here's the cedar, and you can barely see, the light's too bright, but there's these little gray flowers in here, little things that if you go up and you whack the cedar bush, now juniper bush, you'll see this big cloud of pollen will come out. And here's the mulberry. This is near where I live. And here's a little inconspicuous flower here, the catkin, which is the pollen-bearing area. The mulberry trees can put out a lot of pollen in about a month. Here's a birch tree in my yard, which is pollinating like crazy. See, you wouldn't think of that as a flower, but those are the flowers on a birch tree. And here's the instrument that I use to collect the pollen grains. Okay, so there's a chamber here that has a greased slide in it that moves up over 24 hours, and there's a slot that pulls the air in here. There's a Swiss clock assembly inside that moves that up, and this thing is on ball bearings, and there's a fan here that sucks air through the chamber, and this rudder keeps this whole apparatus facing upwind at all times. There's a rain shield to keep rain from coming in. So after 24 hours, I take the silicone slide, grease slide out of there, okay? And here's a swath of pollen on it. And I put that under, stain it, put it under the microscope, and identify each one of these types of pollen, okay? Now, unfortunately, the pollens don't come with labels like this. Okay, so there's birch and oak and cedar, and here's a cedar popping open, okay, looking much like a Pac-Man. Here's mulberry, which is small. There's a mulberry here, another one here. Pine, which are big. So after a while, you get to know all these like faces on your familiar friends, okay? And there's, again, the pollen counts at different times of the year. Here's some pictures of things that you should not put in your yard: juniper and Italian cypress. Birch trees, okay, they put out a lot of pollen. I showed you the picture of the tassels coming down. Oak trees, okay. Anything that has a big flower on it's good. Things that have an inconspicuous flower, this is at Stanford Medical Center. Inconspicuous flowers you don't use. Grasses, get that AstroTurf stuff, okay? And you won't have to mow your lawn, okay? Now, this is a pollen grain. I'm showing you this for a reason, that they're pretty big. And one of my professors, when I was a resident at UCLA, wrote a paper after I left saying that these pollen grains are way too big to get into the lungs, and therefore this concept that asthma was due to pollen grains was wrong. That there was no such thing as grass pollen-induced asthma. So a guy down in Australia named Sophia-Glue, I think is a Thai name, he put pollen grains in water, and they burst, and all these little particles came out of them, and those particles are small enough to get into your lungs. And he did this because down in Australia they have asthma during thunderstorms. So the reason that they have asthma is the grass pollens are bursting and causing asthma. So there was an editorial in the Lancet together with this article called "Pop Goes the Asthma." Okay, so don't always believe what you read in the medical journals. All right. Here's walnuts. Here's a walnut, and here's a walnut pollen. Later on in the year, you get olive trees that pollinate. And then I showed you a picture of ragweed because you can imagine something with pollens that are prickly like this could irritate your nose. But this is a type of ragweed, but ragweed is not an important allergen out here. Okay, and another one is Artemisia. I put this picture up because it's also called sagebrush, and sage is a beautiful green color. Okay, so I just want to show that picture. It's called Artemisia tridentata because there's 3 teeth on the leaves right here. And then my patient brought in these leaves with all this black stuff on it one day. So I put it on the microscope and looked at it. It's full of mold. Okay, this is where the outdoor molds come from. Is from leaves. The molds are another method for Mother Nature to break down natural materials. So their molds are very varied. Okay, but unfortunately, allergy shots, where we do allergy shots to molds, but sometimes it doesn't work that well because our extracts are a little bit weak, and there was a paper coming out of Europe that said that in order to get really good results with mold shots, you had to give them molds to such a high dosage that everybody had a reaction. Okay, so we're careful about that. So the first thing about allergy, what can you do? Avoid it. Okay, if you're allergic to dust mites, remove carpets, vacuum daily, cover mattresses and box springs, use an air purifier. If you're allergic to dogs, keep them outside. Landscape with plants that are not on the list I showed you, okay? Things with flowers are good. Avoid pollens in the spring. If you're allergic to food, stay indoors or go to the beach, okay? I keep telling the insurance companies that they should allow me to write prescriptions for people to go to Hawaii for 3 months in the spring, okay? Stay at the Ritz-Carlton Hotel on Maui, okay, for 3 months, and then you won't have any allergies in the spring. But the insurance companies have not taken me up on that. Okay, if you're allergic to foods, avoid them. Okay, that's another talk. Okay, here are some of the common pills you can take. Zyrtec, Claritin, Allegra, Clarinex. Okay, they're all shown here. You guys, it's in your handout, and you guys are aware of these antihistamines for allergies. If that doesn't work, you go to nasal sprays, which I don't have a picture of. Now for asthma, you start with bronchodilators, rescue inhalers first. If you have to use Ventolin or Proventil or ProAir or Xopenex more than 2 times a week, you go to inhaled steroids. If those don't work, you go to combination medication. Okay, that's what you're supposed to do. Now, a few charts of prevention of allergies. It used to be said that you should restrict foods during pregnancy. Don't eat allergenic foods. Now we don't think that there's any proof that that's the case. Breastfeeding for at least 4 months may reduce the incidence of eczema. Whether it prevents allergies later on in life is not clear. When should you reduce peanuts and other foods into the diet? The old rule was avoid cow milk to age 1, eggs to age 2, and peanuts to age 3. But there was a study from the compared United Kingdom versus Israel, and they found that the delayed introduction of peanuts in England actually led to more allergy to peanut. But in Israel, they used some kind of food called bamba, B-A-M-B-A. And I don't know exactly how that's prepared because we know that boiled peanuts are not as allergenic as roasted peanuts. Now in China, they use a lot of boiled peanuts. The overall per capita consumption of peanuts is the same in China as it is in the United States, but they have a much lower incidence of peanut allergy, and I think it's because they use boiled peanuts, which are less allergenic than roasted peanuts. Because I have a picture here. This is getting scientific, but all we have to say is that the higher on this curve it is, the more allergenic it is. The lower on this curve it is, the less allergenic. And you can see if you take raw peanuts and compare it to roasted peanuts, the roasted peanuts are more allergenic. We don't know where boiled peanuts are on this, because that has not been done. But I think that roasting the peanuts is probably one reason that there's more peanut allergy in the United States. So there's no evidence that, there's no evidence that avoiding foods such as cow's milk, eggs, and fish during breastfeeding helps. I think we talked about that a little bit. And avoiding peanuts during pregnancy did not prevent peanut allergy. So I think you can pretty much, women can pretty much eat what they want during pregnancy. And there's no benefit of using soy milk versus regular cow's milk formula, etc. There's some evidence that in very allergic kids that have used pre-digested milk such as Pregestimil and Nutramigen and Alimentum, it may delay the onset of food allergy, but does not eliminate all allergies. Eventually you're going to get it. Now, as far as probiotics are concerned, one study showed decreased eczema from using it, but another study showed that you're more positive to food skin tests when you use probiotics. So I don't think there's any kind of evidence that you can prevent the progression of allergies, unless perhaps you want to live in a very primitive economy and let your kids get really sick with infections. And I don't think anybody wants us to do that, okay? So that's it for my lecture, and now we are open to any questions that people have. Yes?
Dust mites bite.
Dust mites do not bite. There are mites that do bite, and they're called scabies mites. They burrow under your skin, but this is a different kind of mite, okay? There's probably 20,000 different species of mites in the world because they break down materials just like molds do and bacteria do to recycle organic materials. Any other questions? Yes? Yes, you.
I was wondering, my dad was telling me that when he was in the Army years ago, he was a World War II veteran,
Mm-hmm.
that he developed an allergy to soy sauce. And a few years after he got out of the
Mm-hmm.
Army, he decided to try again Asians with our soy sauce.
Mm-hmm.
And he had no allergic reaction after that. I mean, can you address
Well,
why would something like that happen?
Well, the question is, her dad had an allergy to soy sauce and later on tried it again, he was okay. Well, there's a possibility he had a bad batch of soy sauce. And the other possibility is that his allergy wore off. Now, people have the misconception that allergies are forever, and they're not necessarily forever. And if you eat them if you eat foods that you were once allergic to in some sort of scheduled fashion, sometimes you can overcome the food allergy. And they're doing trials in North Carolina with peanuts, giving kids who are allergic to peanuts small doses of peanuts and watching this. Some of them can eventually tolerate the peanuts. And in our office, Kate Nelson and Anlin Shu are doing challenges with baked milk products. Kids who are allergic to milk, and there's a protocol that they got from the Journal of Allergy, where you give them first a quarter of a muffin, see if they tolerate it, and give them a little more, and after a while they can take baked milk products, and after that, going to try to give them small amounts of regular milk, and sometimes you can reverse that milk allergy. And then they're going to try it for eggs. Nobody has tried it for peanuts yet. Dr. Wesley Burks in North Carolina, he used to be at Duke, now he's at the University of North Carolina, has done a lot of the peanut desensitization work. He came out to talk with us and he said, it's not ready for the clinic yet. He has 12 people, full-time people working on the biology of this, making measurements and keeping statistics and watching the kids. So, and only half the kids can be successfully desensitized to peanuts. So It's still a major problem. There's 1 million kids in this country that are allergic to peanuts. Now, they had a drug which was similar to Xolair, which was on the market. It wasn't on the market. It was about to be approved, that you could get shots. It would have been expensive, but it could be life-saving in kids who had peanut allergy. But there was a patent dispute between the people that made this drug Tanox and the people at Genentech who made Xolair. And eventually what happened is Genentech bought out Tanox, at which point they wanted to have their drug Xolair used for peanut allergy, and they put Tanox on the shelf. And their Tanox sits on the shelf, not being used by Genentech. And 1 million patients around the country could probably benefit from it. And it's sitting on the shelf. And they tried their trials with Xolair, but unfortunately, the clinical trials had used up most of the patients that had taken Tanox, and when the academic centers went to look for other kids to do the trials on, there weren't any kids left, so they haven't been able to do meaningful trials with the Xolair. So Xolair would probably work also, but it's been delayed for a long time. And for something that expensive, insurance companies are not going to cover it until the FDA actually approves the material, which may cost hundreds of millions of dollars to get it through clinical trials when they're able to do them. So it's going to be a while. Yes?
I have a question about stinging insects. I get stung by a wasp, and I guess you call it a kind of minor reaction. But I've been told by someone who's really allergic to it and carries an EpiPen that if I have stung again, it's possible my reaction could be more severe. How does that work? Is there a percentage case where that happens?
So she's saying that she was stung by a wasp and had a minor reaction, and wonders what would happen if she were stung again. As one of her friends said, that it's going to be a much worse reaction.
Or could be.
Could be. Well, the American Academy of Allergy has studied this, and they have said that their official stance is that if you have a large reaction, if you have a small reaction, there's no evidence that's going to progress to larger and larger reactions. If you have a large reaction, that sometimes does progress to a more severe reaction, but the chances of that happening are so rare that they don't recommend that you have allergy shots for that. So, and you have to remember that if you have an allergy to stings and you're not stung for a long time, you can lose the allergy to it. And like beekeepers that get stung by insects, if they have a severe reaction and they keep getting stung, sometimes it's acting like allergy shots, and if they survive it, they'll be immune. Okay? I don't recommend random stings as a way of getting your allergy shots. You could have a catastrophic reaction and have no recovery.
So severe include like breathing difficulties, and minor would just be swelling?
So the criteria is if you have anything swelling or worse in an adult, that is hives or worse, that is considered reason for skin testing and possibly allergy shots. In kids, you don't worry about a few hives. But if they have anything else, like wheezing or collapse, definitely. Excuse me. Maybe I ought to stop. Yes, go ahead.
What is your position on
Gluten sensitivity is, first of all, gluten is found in 3 grains, wheat, barley, and rye. And normally enzymes in your body break down the gluten to smaller particles. But there's something called transaminase that can break down a particular portion of the gluten to an allergenic substance, and you have an excessive amount of the transaminase enzyme in your body. This may lead to you're becoming sensitive to a portion of the gluten, okay? And we call that celiac disease, okay? And the symptoms of that are when you eat wheat, barley, or rye, you have, thank you, Marilee, you have a lot of bloating and and discomfort in your stomach, perhaps some diarrhea or something like that. And the way to make the diagnosis is to have blood tests, tissue transglutaminase and endomysial antibodies. Gastroenterologists do that, and also allergists can do that. And the treatment is avoidance of certain substances. So corn and rice are okay. Okay, it's wheat, barley, and rye that are bad. Oats are probably okay, all right? So it's a different kind of sensitivity from the typical allergy. Yes?
I have how many different kinds of inhalers and
Yes.
bronchodilators, and I think it's called medication. Anyway, I used to have such severe sinus headache that I just got hard to stand.
Mm-hmm.
And I had a radiant doctor at that time, and she suggested that I start doing daily nasal flushes, and twice a day my allergies were really bad.
Mm-hmm.
I do my daily nasal flushes ever since then with normalcy.
Mm-hmm.
I don't have problems like that anymore,
Mm-hmm.
but I do have problems with perfume and smoke, which of course you can avoid. But I happen to live in an environment where I'm surrounded by smokers, and I can't be outside doing my garden work because I get all my allergy symptoms.
Mm-hmm.
And I would have to resort to a gas mask. I'm serious. I'm not joking.
Perhaps you have irritant factors that are bothering you, and the only way to do that is avoiding them. What was the first thing that you had trouble with before that was helped by the sinus, the nasal flushes?
I don't even know what I was allergic to. It seemed everything was bothering me when I started doing the flush. But perfume
And cigarette smoke
cigarette smoke,
still bother you?
yes. But where I am now, I'm surrounded by smokers, and I love working in my garden. And I talked to them. Two of them were cooperative, the other one was not. And I don't know if I'm going to have to move or if I should resort to a gas mask.
Well, I can't give you advice on whether you should move or whether you should wear a gas mask or some kind of respirator. There are respirators you can wear. I don't know, to get a professional one, it'd have to fit pretty tightly. It might be easier to move. I'm serious. I mean, I have patients who have moved out of homes because there was a tree that they have not been able to tolerate in their neighbor's yard and things like that. Yes?
Thank you, Becky, for I seem to get allergic to the winter, like rain. And when it gets cold, it can be my sinus infection.
The question is there anything you can do about cold and rain?
No, it seems to be, that's what I seem to have allergies to.
She seems to have more trouble during cold
Cold
and
and
rain.
That's what I feel. I
And-
saw the picture up there of the child with the dark.
Yes,
that I get
circles,
that.
yes.
But I don't get the running, I get the very thick, so thick that I can wake up in the middle of the night and choking on the heavy music.
Well, I think-
I didn't
weather can definitely be a triggering factor for allergic type diseases. The best work is on asthma, and we know that changes in barometric pressure, and pressure becomes lower when a low front moves in, the barometric pressure goes down. There's been no correlation with negative or positive ions. So at one time, there were negative ion generators that were being sold, but they had no effect on allergies. But changes in barometric pressure apparently do have some effect on allergies, but there's nothing we can do about changes in barometric pressure. If you have a lot of mucus, you might need an allergy workup, or you might need a sinus evaluation to make sure you're not suffering from sinus disease. Those are the most common two causes of excessive mucus, is either allergy or a sinus condition. Yes, over here for a new person.
Costco puts out a very cheap pill that's very similar to Zyrtec,
Yes.
and it works, but what's the difference between that? Because Zyrtec's what, 30, 40 cents a piece, and Costco's is only 2 or 3 cents?
I've tried both of them myself, and I think they're about the same. Now, the generic pills have a little bit more leeway. I don't know exactly how much, but I read somewhere once that they said that a 10 milligram tablet can have 8 milligrams of the active ingredient, or it can have 12. So it's plus or minus 20%. So I know some doctors that have patients who absolutely cannot tolerate generic drugs of other sorts. Got a question here.
What do you think of nasal flushes for controlling allergies?
I think nasal flushes are a great idea. There's something called a Neilmed sinus rinse, Neilmed. It comes in a squeeze bottle and it comes in a neti pot. I like the squeeze bottle. And if you have lots of excess mucus, you put 1 packet of the saline salt in there, and you fill it up with 8 ounces of previously boiled water that has been warmed a little bit, or you can use bottled water, or you can use distilled water, and that makes it about the same strength of ions as in your body, and you flush it into your nose and blow, and it'll go up your nose and out the other side, and blow gently, and it'll help you get the mucus out. And we do that a lot for patients who have chronic sinus disease.
So normal saline is not sufficient?
You can use normal saline, but I think it's a lot cheaper and more convenient for you to get the packets. You can get 120 packets at Walgreens. You can do it twice a day, so that's enough for a couple months. And that's for like $14. You want to spend about $16, you can get 240 packets at Costco with 2 of the bottles. Okay, it would last you 4 months or so. So it's cheaper than having to deal with, bottles and bottles of normal saline.
You can make your own normal saline with boiled water.
You can. You can put 1/4 teaspoon of salt into a glass of water. But these packets have their alkalinity and acidity adjusted to pH 7.4. So you're going to get a more accurate, less irritating compound than if you use regular table salt. But you can put 1/4 teaspoon in 8 ounces of water and use that. But use warm water, don't use cold water, and don't use tap water, which has been associated with amoebic infections. Yes, one more question.
Speaking of Zyrtec and Claritin,
Yes.
what are the differences and how do you know which one to use?
The question is, which one is, what's the difference between Zyrtec and Claritin? There are 3 that are on the market. There's Claritin, Allegra, and Zyrtec, which are all considered 2nd generation antihistamines. Claritin is non-sedating, Allegra is non-sedating, And the Claritin's probably the weakest of the three. Zyrtec's the strongest. So, the Zyrtec can make you sleepy. It can give you Z's. That's how I remember it can make you sleepy. So either Allegra or Claritin. And you have to try the two and see which one you like better. Neither of those should make you sleepy.
They all act about the same.
No, I think that Claritin's the mildest. Allegra's a little stronger for most people, but sometimes there are differences. You have to try them. And the Zyrtec generally is the strongest. Benadryl works really fast, but it also causes real sedation. So be prepared to go to bed if you take a Benadryl. Just go ahead.
What is your recommendation for people with food allergies? Should everybody with food allergies be carrying EpiPen?
I think you should have, you need to, the question is, does everybody with a food allergy have to carry an EpiPen? The question is, how severe is the reaction that person had? And I think this is something that you have to have evaluation between the patient and the doctor and the patient have to together make the decision whether you're going to carry that EpiPen or not. It's a real doctor-patient relationship that you have to decide that kind of thing. Thank you very much, everybody.